So polycystic ovarian syndrome is a condition that affects 15% of women in the reproductive age. I call it the silent epidemic. These are patients with a group of symptoms, and unfortunately, they almost never get diagnosed in time. They can have irregular periods. They can have elevated testosterone symptoms like acne, hair loss, facial hair, body hair, weight gain, mood disorder, depression, anxiety. And it's the top cause of infertility on the planet. And yet these patients are not being diagnosed in time.
What are some of those underlying conditions that women should look out for?
So a majority of polycystic ovarian syndrome patients suffer from insulin resistance, which means their body cannot process the sugar they eat. Unlike other patients who eat sugar and their sugar turns into energy in the body, PCOS patients have insulin resistance, which when they eat carbohydrates and their bodies break it down to glucose, the glucose doesn't make it into the cell to turn into energy. It bounces in the blood and gets stored as fat. Because this blood sugar in the blood increases their insulin level, that high insulin has also a side effect of elevating their testosterone and causing, or androgens, and causing all these other symptoms that are associated with polycystic ovarian syndrome, which could be very difficult for them to manage. These are patients who go to the doctor with acne and they get acne medication, but it doesn't really work for them, or they keep gaining weight, or they have irregular periods, they have difficulty getting pregnant, they lose their hair. Usually, I mean, I walk down the street and I can pick out PCOS patients as I'm walking down the street. And I know that these patients are not getting diagnosed. And it has always been a passion of mine to bring awareness to this condition.